And each year since 1963, Congress has charged the President to proclaim February American Heart Month. The goal of American Heart Month is to raise funds, conduct research, and promote education about heart disease and stroke. According to the Centers for Disease Control and Prevention, heart disease is the leading cause of death in the United States and a major cause of disability. The most common heart disease in the U.S. is coronary heart disease, which often first appears as a heart attack. Almost 1.2 million people in the U.S. will have a heart attack, and about 700,000 people die of heart disease annually. Each of us should continue to take steps to prevent and control factors that put us at greater risk. Prevention measures certainly help to reduce the risk for heart disease and its effects. Additionally, knowing the signs and symptoms of heart attack are crucial to the most positive outcomes after having a heart attack. Recognizing and responding quickly to symptoms and receiving appropriate care can limit heart damage. People who have survived a heart attack can also work to reduce their risk of another heart attack or a stroke in the future. And research has shown that a healthy diet and lifestyle are the best weapons you have to fight heart disease. I'd just like to thank the gentlewoman from California, Congresswoman Juanita Melinda McDonald, for her work on this issue, and I certainly urge my colleagues to support HCON Resolution 52. And, Mr. Speaker, at this time I reserve the balance of my time.
Gentleman reserves. Gentleman from Oklahoma.
Thank you, Mr. Speaker. I yield myself as much time as I may consume.
Without objection.
I rise today in support of House Concurrent Resolution 52, a resolution supporting the goals and ideals of American Heart Month. I commend Ms. Melinda McDonald for her efforts in bringing this resolution to the floor. Beginning in 1964, the President had issued a proclamation every year designating the month of February as American Heart Month. It is important to recognize the need for greater heart health. Heart disease is a leading cause of death in America. This year alone, over 1.2 million Americans are expected to experience a heart attack. American Heart Month renews the need to recognize and respond to symptoms of heart damage. Great work is being done by the American Heart Association to reach out into communities and help provide instructional programs on heart disease. It is important to have policies in place that ensure access to screening, referral, and counseling services for stroke and heart disease risk factors. I believe Congress should continue to support the goals of the American Heart Month. This resolution is important in that it continues to encourage Americans to take a healthy approach to living and protecting their hearts. Mr. Speaker, I yield back.
Gentleman from New Jersey.
Mr. Speaker, at this time I'd like to yield 5 minutes to the gentlewoman from Illinois.
Gentlewoman from Illinois is recognized.
I thank the gentleman for yielding to me on this important issue. On December 30th, 1963, Congress requested that the President issue an annual proclamation designating February as American Heart Month. House Concurrent Resolution 52, supporting the goals and ideals of American Heart Month, reaffirms the federal government's commitment to fighting heart disease, recognizes Americans struggling with this illness, and encourages Americans to take preventive measures to protect themselves from heart disease. I want to recognize the sponsor of this resolution, Representative Juanita Melinda McDonald, and thank her for her leadership on this and other critical health issues. Over 79 million, or 1 in 3 American adults, has cardiovascular disease, including high blood pressure, coronary heart disease, heart failure, stroke, and congenital cardiovascular defects. The lifetime risk for cardiovascular disease for an individual aged 40 is 2 in 3 of men and over 1 in 2 for women. Cardiovascular disease was the underlying cause of death for well over a third of all the 2.4 million deaths in the United States in 2004. Cardiovascular disease accounts for more deaths than any other single cause of death in the United States. Nearly 2,400 Americans die of cardiovascular disease each day, an average of 1 death each 36 seconds. The estimated direct and indirect costs of cardiovascular disease in 2007 are $431.8 billion. Heart disease is a significant factor in driving up medical costs in the United States. About 2/3 of unexpected cardiac deaths occur without prior recognition of cardiac disease. This is an important point to underscore, and it highlights the need for American Heart Month. Public education can help raise awareness, encourage preventive measures, discourage unhealthy behaviors, and persuade more Americans to get regular medical exams. By doing so, we will be able to reduce the incidence of heart disease. We can lower those numbers that I've just mentioned, but we can also improve and extend the lives of real people, our family members, friends, and neighbors. That is what American Heart Month is all about. We know the risk factors that lead to heart disease: high blood pressure, high blood cholesterol, tobacco use, physical inactivity, unhealthy diet, obesity, and diabetes. Cigarette smoking results in a 2- to 3-fold increased risk of dying from coronary heart disease. We also know the ways to manage risk and prevent heart disease: regular exercise and maintaining a healthy weight, healthy eating habits, avoidance of tobacco, drugs, and excessive alcohol, getting regular checkups to be screened for signs of heart disease risk. American Heart Month is particularly important in getting the word out to those who are disproportionately affected by heart disease and who too often fail to receive the treatment they need. Women and minorities may have atypical symptoms when suffering a heart attack or angina if they are sent home undiagnosed. They are about twice as likely to die from these symptoms as those who are admitted. Heart disease is the #1 killer of women in this country, claiming over 349,000 American women each year. Raising awareness and improving treatment and screening can save many lives. 42% of women who have heart attacks die within 1 year, compared with 24% of men. This may be because, on average, women are older than men when they have a heart attack. It also may be because heart disease in women is not typically diagnosed or treated as aggressively as that in men. Cardiovascular disease is the #1 killer of women in the United States. Experts estimate that 1 in 2 will die of heart disease or stroke, compared with 1 in 25 women who will die of breast cancer. Existing heart disease is undiagnosed in half of women who have a first heart attack. Management of chest pains differ by race and sex. Men are more likely than women to receive definitive diagnoses as opposed to of angina as opposed to vague chest pains. Women and blacks typically receive fewer cardiovascular medications than men and whites. Lack of studies on women limits usefulness of research on coronary heart disease. Though it causes more than 250,000 deaths in women each year, much of the research on CHD, coronary heart disease, in the last 20 years has either excluded women or included very few women. As a result, many of the tests and therapies used to treat women for CHD are based on studies conducted predominantly in men and may not be as effective in women. Again, I want to thank Representative Melinda McDonald for her leadership, and I urge all of my colleagues to support H-Con Res 52. I yield back.
Gentleman from Oklahoma.
I have no more speakers, Mr. Speaker. No one else. No more time.
Gentleman yields. The gentleman from New Jersey.
Mr. Speaker, I don't have any more requests for time at this time, so I would yield back the balance of my time.
Both gentlemen have yielded. The question is, the House suspends the rules and agrees to House Resolution 52. Those in favor say aye. Those opposed, no. In the opinion of the chair, 2/3 being in the affirmative, the rules are suspended. The concurrent resolution is agreed to.
On that, I demand the yeas and nays.
The yeas and nays are requested. Those favoring a vote by the yeas and nays will rise. A sufficient number having risen, the yeas or nays are ordered. Pursuant to Clause 8 of Rule 20, further proceedings on this question are postponed.